everyone. My name is Sascha Nottmeyer, and I've been asked by the organizers of the to take care of communications around the symposium. I'm glad that some of you could make it today to join us here and learn more about the societal impact of pain. I'm happy to say that we have gathered quite an impressive lineup of speakers today, coming from different areas connected to the healthcare system, from pain patient representatives to officials from the European Commission to industry, pharmaceutical industry representatives. So we have quite a diverse lineup, I'd say. During the next approximately 20 minutes, they will tell you more about the burden chronic pain puts on individuals, society, and the economy as a whole. And finally, what our experts think policymakers should do to tackle the issue. I'd also like to welcome those watching via the live stream through the internet. I appreciate that not everyone can come to Malta, so it's glad that you can join us via the internet. We will start off with Joop Greensven, President of Pain Alliance Europe, who will outline what kind of impact pain still has on society today. Afterwards, Mr. Zekel, Deputy Director General of the European Commission, DG Health and Food Safety, has some news to share with you regarding the Commission's plans, how stakeholders can work together in the future. Afterwards, Bart Marlion, President-elect of the European Pain Federation, will provide you with a brief introduction on this year's symposium, the different working groups that beavered away yesterday, and the policy recommendations that have been drafted as a result of these working groups. Next up will be Gabriel Bertschi. Gabriel is the CEO of Grüntal Group and also a board member of FPA, the European Federation of the Pharmaceutical Industry. And finally, Gertrude Buttigieg of the Malta Health Network will provide her views on co-hosting the symposium on Malta this year. And then we also have Mariano Votta from the Active Citizenship Network, who will provide you with his insights, as well as Mario from the No Pain Foundation. Now I've talked enough, I think, and I'll hand over to Joop. Stage is yours.
Good morning, everyone. My name is Joop Greensven. I'm the president of Pain Alliance Europe. Pain Alliance Europe is a pan-European umbrella organization of 36 members from 17 European countries, all involved with chronic pain, regardless any underlying condition. Our mission is to improve the quality of life of people living with chronic pain, and quality of life is something which you have or have not, and pain still has a great impact on that, not only on society, on the healthcare system, on the individuals, but also on their families, on the near ones. It's very important to realize that pain is not only by the pain patients, it's a much larger community which has been involved with chronic pain. One of our aims is to improve the quality of life by having more awareness for chronic pain. And if you want to have more awareness, you have to share information about chronic pain. And what better way is it to share information as using a platform on the European level where experts can communicate with each other and talk to each other and with each other, because it's very important to talk with each other as to each other, about best practices, what they think about how to deal with chronic pain. And not only the experts, the healthcare professionals, but also the policymakers, also the politicians, everyone who has a role to play in chronic pain. As you know, 1 out of 5 people with adult people living in Europe has chronic pain in some way. And out of those 5, 1 of the 5, 25% has so much severe chronic pain that they can't participate in society. And with some simple measures, we can decrease that number so more people can be active in society, which has an enormous impact on the budget for healthcare systems, but social systems in Europe. But that would be great if we could have that platform where we can share that information. Pain has a huge influence on the individual. It makes that he cannot participate in society as you would like to. So it's not only the physical, but also the mental issues are very strong with people with chronic pain, because it is really something that you're putting aside in society. But it affects not only that simple person, it affects the wife, the husband, the children, the grandfather, the neighbors, the family. It's so much bigger than just one person who is struck by chronic pain. It's, well, if you would allow me, I could speak for hours about that. What we really should try to achieve is a turnout that politicians and policymakers are going to change thinking about chronic pain. It is a health issue, it is an economical issue, it is a social issue, it is a societal issue. And that's why we are so happy to get involved in the societal impact of pain. Society needs to do something for people with chronic pain. And I think that I've said enough now.
Good morning. My name is Martin Sekel. I'm the Deputy Director General responsible for health in the European Commission. And I would like, first of all, to communicate the full support of the Commission and of DG Health, DG Santé in particular, for the work of the Societal Impact of Pain Partnership. As we have just heard, this is a very important area, and I must say sometimes certainly underestimated area. But we all know the impact of chronic pain, not just from a health perspective, but also from a societal perspective. And from the Commission's perspective, we certainly attach great value to the work of the partnership. First of all, because we are convinced there is a great need to raise awareness, not just about the issue, but also among the many relevant actors. This is not just an issue from the health perspective, traditional health perspective. It has there are a lot of other viewpoints which are extremely important. And we believe we would really need to support the partnership and really inform about best ways to address pain and increase the quality of life of patients, as we have just heard. So over the past few years, the Commission has been reflecting on how we can work better with our stakeholders. We are very lucky in the health area that we have a large number of stakeholders, many different types of stakeholders, who have enormous experience and expertise in this area, and that can really support the Commission's work. But we wanted to go beyond the traditional way of working, which is the present reaction to Commission documents or the presentation of individual positions. We felt there was a need to take it a step further. And the Commission has set up what we call a new health policy platform, which is a largely IT-based system, a web system, where stakeholders of different origins can actually come together and discuss important issues. Because it's important certainly for stakeholders to address the Commission individually, and they're always welcome to do that, but also important to have a dialogue between stakeholders, and also to exchange points of view and formulate common positions wherever possible that can help inform the Commission's work. And the Commission is offering this space without intervening itself. We will not be in any way influencing the agenda. We would like to allow a really free formulation of ideas. And I'm very pleased in this context to confirm that in this EU health policy platform, there has now been created an expert group network for the societal impact of pain. This is one of the first thematic groups which has been set up. It shows the importance of this topic, and we would like to also use this to harvest ideas, and I will say something about that in a minute. As I said, this will be really driven by the stakeholders themselves. They will organize their work. They can decide on what they want to work on. They can exchange documents. They can share, discuss views. They can prepare and follow up meetings, etc. And the Commission will obviously be making full use of what comes out of this thematic network. I am very confident that the Societal Impact of Pain Partnership will find this very useful. It is a concrete way in which we can actually improve the sense of involvement of stakeholders and citizens in EU policy making, which we all agree, I think, is one of the areas where we need to continue to improve. At the moment, just to give you an idea of the scale of this, in the EU health policy platform, we already have more than 1,000 registered users. These are individual organizations, stakeholders. So you can see just how rich the health stakeholder community is. And we are bringing others on board on a daily basis, because there are many, many stakeholders who are realizing they have an interest in health, not just the traditional health stakeholders, you know, the patients' organizations, the professional organizations, the industry, etc. But also new stakeholders are realizing that health is a fundamental issue. And we would like to encourage this thematic network to consider the possibility of finding a consensus on issues that they would select, and possibly also come up with joint statements that the Commission could then utilize in its policy making or make available to the member states. I would like to highlight, before I conclude, some areas where I think we definitely could work very well together. First of all, it was already mentioned, the issue of the best practices. I firmly believe that the European Union should be a community of practice. We have a lot of expertise on practically every issue. We have experience, sometimes at national level, sometimes at European level, sometimes even at regional or local level, on how those issues can be tackled. But unfortunately, best practices don't often travel well. They remain in their original area. And decision makers need to have options. They need to have the evidence to identify what is appropriate, what is suitable for their context. And this is where the European Commission can help, because we have the possibility to work with different actors at different levels. So I see a very important area of work in areas such as chronic pain, but also other challenges in the health area, the identification, the evaluation, and the scaling up, important scaling up of best practices. We need to use the very powerful EU-level instruments, funding, policy instruments, etc., to support the scaling up of best practices. Best practices should become standard practices. But this will not happen spontaneously. It needs a concerted effort, and it cannot be done by the Commission alone. In this context, we should also look at how we can make better use of EU-level instruments. I mentioned the very powerful funding instruments. You know? Programs of all shapes and sizes that we have in the EU, the research program, structural funds, the health program, but also other instruments that could be used in the social area, for example. And we are approaching the period after 2020 where we'll have the new budget of the EU. It's very important to start thinking now about the kind of instruments we would need to better support implementation, because EU funds their positive impact should be felt by citizens. One final point I'd like to make, which I think is very important, and here again we very much depend on our stakeholders to help us with this, is to improve the link with the national stakeholders, the national organizations, and to have, to create a link between discussions which are happening at European level and the very important discussions which need to happen at the national level. Very often I think we make the mistake in Europe that it's an either or. we spend a lot of and waste a lot of time discussing whether something should be done at European level or at national level. This is not a useful discussion. It's more useful to consider what could be done together, because we all have different tools. The European Union has its tools. National governments have their own tools. They cannot replace each other. We have to work together. And this, I think, should be the way forward, particularly in an area like health, where, of course, the responsibility for the delivery and organization of health systems is with the member states, and in some cases, in some countries, with the regions. But the European Union can support, can facilitate. And we really, to do that, we need to improve the linkage. So whatever is being discussed at European Union level should find its way into the national discussions, national dialogues on health, on the social dimension, for example. And we should support member states and stakeholders at the national level to fully utilize the resources available and the expertise available at European level. So really, we are very happy with this work, and we stand ready to work very closely with you to really bring this important topic to the forefront of the health agenda. Thank you very much.
Ladies and gentlemen, my name is Bart Morlion. I'm the EU liaison officer and president-elect of the European Pain Federation, and by being Belgian and living near to Brussels, I had the opportunity to have many discussions with many people, together with our stakeholders of the Societal Impact of Pain platform. Just to give you some brief information about my organization, we are a federation of European national chapters of professionals in the area of research, treatment, and advocacy work around pain. And we represent about 20,000 professional healthcare providers involved in all these aspects of pain. And I'm very happy that since 2009 we were able to team up with very important patient organizations, and you heard already Job van Greensvens on behalf of the Patient Alliance Europe, but also Mariano Votta from the Active Citizen Network. And I want to thank also the Maltese organizations for hosting the SIP here on Malta. Over the years, we teamed up and were endorsed in our scientific aims. So, because we're a scientific organization, these aims were endorsed by over 300 stakeholder organizations, which is quite amazing. And compared to the 1,000 I just hear, so we could bring in another 300 maybe into the platform. So we really want to raise the awareness of the problem of pain, and also especially chronic pain, because pain is something which is really transversal, present throughout the society. It's not about one disease. It can be linked to cancer, can be linked to musculoskeletal disease, and in many cases it's not very clear where it comes from, and that's very challenging. And we have to convince also policymakers on an EU and a national level that there are issues in the management of this pain, and also in the societal structures dealing with these problems. And therefore, we have, yesterday we worked hard in 4 working groups, and we had 4 task-oriented working groups. And one of the first group discussed the use of pain as a quality indicator for health systems, because we're convinced that a good functioning health system takes care of pain. So, and we also need quality indicators. We need to know who is doing the best. And to give you one example, in many European countries nowadays, if you want to get accreditation of your hospital, you need to pay attention to pain, and they will check it. But it's not common use in every European country. We want to stress the impact on labor and employment, because of course, if we look at the numbers of chronic pain being over 100 million patients in Europe, that means there is a lot of absenteeism, but also presenteeism is a problem. And there are many we heard many nice examples of national efforts how to reintegrate patients and to help them in an adapted way to reintegrate, because also social reintegration of pain patients, employment plays a very important role. And then we listened in the fourth group to in the third group on how are platforms created, and we are very, very excited about the move of the European Commission. And so the platform on the expert group network on social impact of pain has been created, and we hope to convince also 300 stakeholders to participate in this discussion. And then we listen to the best practices of what's happening on a national level. Because the problem in Europe is we see many very excellent initiatives in every single country, but we do not know what's happening from each other. So we shared these best practices, and this is really very in line with the wishes of the commissions. And therefore, we will have a plenary session immediately after this press conference, where we will call the European government and the EU institutions, and we formulated formulations, and you can see them on my right side, your left side. Establishment of a EU platform. I think we heard that it's a very nice start, and this is work in progress. So we have to create content, get into discussion, attract even more stakeholders on this platform, and then to be able to make also prioritize issues and making an agenda for the future. Development of instruments to assess the societal impact of pain. Of course, we cannot discuss deal with policymakers if we do not get the right numbers. So we need also the instruments to get good insight into the problem. Not only insight in the prevalence, in the population, but also what are the financial implications, for instance, of pain. And then initiate policies addressing the impact of pain of employment. I already elaborated on this, so it's quite important. Knowing that, for instance, chronic pain is something which can be influenced by many contextual factors. Also being able to participate in a social life, not only on a private level, but also into an employment level is which something where many patients benefit from, but they need adaptations, they need reintegration. It's not a black and white story. So for some patients it would be possible, but they need the right policies and the right environment for this. And then prioritize pain, the education around the topic of pain, not only for healthcare professionals, but also for doctors, nurses, psychologists, physiotherapists. That's the first step. And still we see that these are hard numbers. We checked this with the European Pain Federations a few years ago. It comes out that in many European countries, people who are studying for veterinary medicine get more hours on dealing with pain than medical doctors. So we still, and there are very nice lighthouse examples in some countries where they really have a very good approach to the education, but we really also need the education of the general population and the patients, because you only can get into a partnership within healthcare systems if the patient takes the lead also in the communication of its own problem. So, and then last but not least, we call for an increase in investment in research, but we're very hopeful that the creation of this network will be able to indicate lacks, gaps in research, and that we will be able also to give the instruments and advise the Commission in which direction we can go after Horizon 2020. So all these initiatives are taken, and we're very happy to work together on this to improve the life of those who suffer from pain. Thank you very much for your attention.
Thank you. I'm Gabriel Birchie. I'm a FPR board member and also CEO of Grüntal, a company which is solely dedicated to inventing new products in high unmet medical need areas in pain. You heard pain is a real burden, so I'm not going to repeat it too much, but for me, having a number of 1 out of 5 suffering from chronic pain shows really the issue we face across Europe. The chronic pain has also a cost, and there are some estimates showing that pain costs up to 2% of GDP, depending on countries. So there is really an economical cost, a societal impact, which you have heard, and of course, a patient suffering from it. We at Grünenthal, but also mainly FPR, support SIP, but also very much salute the initiative which was presented by Martin Sekel, which really brings, pain on the agenda at a European level. There is a need to do that. We believe that fostering collaboration between all actors, whether it's academia, patient association, physician, nurses, which play a very important role as well, the industry, the policymakers, the payers, is very, very important, because you can only drive solutions by working collaboratively among every stakeholder. It's not something that can happen in isolation, either from the industry or the policymaker. The industry, of course, has its role to play. Research in pain is not easy. There are a lot of, statistically, you can read a lot of publications showing that pain is actually, most of the time you fail when you research in pain, because there are a lot of components which are, subjective on one end, the patient subjectivity to it, but also mechanistically, it's not easy to find a new product to treat pain. And industry has to invest money. There is other instrument. I'm saluting a lot the IMI instrument. That's a lot of funding available for academia and the different, let's say, consortium researching on pain to work together. We need to continue this because it's very important. FPI is spending about 31.5 billion in research every year. This is a very big amount. Grünenthal spends, to give you an example, about 20% of its revenue into pain. We need to continue that. But again, it's a very expensive journey to find medicine in the pain field, and therefore it's important to work in a collaborative way with academia and the different stakeholders. I would like to say SIP was the beginning. Now it's being brought at the European level. We at FPR salute this, and I'd like to now hand over to the next speaker. Thank you very much.
I'm Gertrude Buttigieg, and I'm representing the Malta Health Network, and I feel very privileged and proud to have been co-hosting the 7th SIP Symposium in Malta, together with No Pain Foundation as the other co-host Maltese organization. This event also has been supported by the Ministry of Health, who agreed to have it in the calendar of the presidency, and also the support of the Ministry of Finance. For us, it has been an honor to bring SIP to Malta. This adventure started 3 years ago. And when we were approached to consider hosting SIP in Malta during the presidency, I never imagined the magnitude of it. But now that we're at the end of the 3rd year, and after, I must say, a very intensive year of working both locally, but also with the SIP platform on a European level, it has been a very fruitful experience. And thus, I feel that our commitment as Malta Health Network to have patients who are suffering with pain, to make the policymakers understand that they can do something, and for their patients, but not just for the patients, it is also for society in general, as has been said by the gentleman before me. So I will not repeat how much we consider pain as having an effect on our society. In fact, as Malta Health Network, we have 40 member organizations from Malta, and we estimate that we represent more than 10,000 patients obviously they have a family, they have a job, so the ripple effect of being a patient is high. When we decided to support pain as an issue, we agreed that it cuts across many conditions. So by looking at pain, we are addressing many patients, not just the cancer patients, diabetes patients, but patients with mental health problems. Pain cuts across many different groups of patients. So we really want to make a difference to the patient's life. For chronic pain, we would like to have more awareness, and we are very happy to be part of the SIP momentum, I would like to say, because I'm sure that what has happened in the past will keep helping us to move on and use best practices, use resources, and use the goodwill of everyone to do the very best for our society.
Good morning. My name is Mauro Mario. I'm a Secretary General and founder of No Pain Foundation. First of all, I would like to say thank you to SIP, and especially thank you to Malta Health Network for this great opportunity. We are a patient advocacy association, and our purpose is to carry out social education and research. No Pain Foundation aims to influence health-related policy and practices for the welfare of the patients suffering from chronic pain. All our activities are aimed to improve quality of life of patients suffering from chronic pain. As we know, in Malta, there's is not recognized chronic pain as a disease in its own right. And this is a really pity. We have the purpose to push the local policymaker to change the view of chronic pain here in Malta. We really hope that with the help of SIP, PAI, EFIC, and of course Malta Health Network, and all the associations and foundations across Europe involving chronic pain, to change the law here in Malta. And finally, have recognized chronic pain as a disease here. It's important to work all together for the benefit of patients who are suffering from chronic pain. We have to work all together at national level with association that works at the European level. This is really important for us. And I think it's really important also for chronic pain. Thank you.
Good morning, everybody. My name is Mariano Vota, Director of Active Citizenship Network, a European platform of civic and patient organization led by the Italian NGO Cittadinanza Attiva that since 1978 promote the protection of citizens and patient rights and the active participation of citizens in the policy-making process. My organization is recognized by the DG Santé, by the European Commission, as one of the relevant stakeholders in the framework of health policy platform. And we are official cooperation partner of SIP for the second year in a row. Well, I'm glad to present to you what we have achieved in 2 years activity. Yesterday, we have presented an initiative. We have collected good practices on chronic pain, cancer and non-cancer related. This was an activity that we have carried out over the last 2 years that very relevant for 3 reasons. First of all, as Mr. Seychelles said before, the issues on pain is underestimated. So our commitment is to make visible the invisible. And probably this is also your commitment. The media have to support this one. You will receive the Gatorade good practice collected, and we have also for sure a summary for 1 page, probably more useful for your work. Not just for this point, to make visible the invisible, also because we can recognize different good practices, but there are also some common elements. For example, the winners are those in which there is a cooperation among all the stakeholders, researcher, university, private and public bodies, patient and advocacy groups. This is very, very relevant. Yesterday there was the award ceremony with the presence of the President of Malta, in which we have awarded initiative coming from UK, pelvic pain, Italy, AdAge, or Spain on fibromyalgia. That's just some example very relevant, also because, and I finish, because I'm extremely in line with the policy of the European Commission, interested to get rid experiences. So this is our commitment to share, to raise awareness, something that are not idea, but are activity already existing across Europe, because you can find initiative coming from 11 countries here. So I hope you can support the constituency of pain, also because over the years we have achieved a lot of political relevant goal. The last one is the platform inside the European Commission, no? The group of experts. But please don't forget what we have achieved in 2014 when the 28 Ministries of Health talk about for the first time the issue of pain in the framework of Italian presidency of the European Union. So this is a good news. The constituency on pain increase a lot each year, more and more. Thanks.
All right, thank you, everyone. Looking at the time, and that some of you need to hop off to the plenary session, I would like to take the opportunity and provide you with an opportunity to ask questions in case you have any. If you could just raise your hand, that would be great. All right, no questions so far. In that case, I'm going to pose one to Mr. Dekel. I've read on the website of the new platform that you're calling for proposals for late this year, coming from policymakers, actually, in the European Union. How do you are going to involve patients and healthcare professionals in that process?
Yes, our thinking at the moment is this. We would like to have a really active, vibrant marketplace of ideas. Certainly, on the one hand, you have the policymakers who need new ideas, new solutions for increasingly complex problems, which are multi-sectorial, multidisciplinary. So that's one dimension. On the other side, you have best practices, you have expertise, you have viewpoints and the perspective of important stakeholders. And we feel that our role is to help bridge these two, bring these two together, create a linkage between those who need solutions and those who have ideas and solutions. This, I think, is a fundamental role that the European Commission can play. So we have put in place also complementary structures, like we are working with member states to ask them to identify to us clearly the areas where they need solutions the most. So we will be issuing a number of calls where member states will decide, they have their structures also, which are the areas where they need solutions. And we will feed that into the platform that I have just mentioned, so that we could invite the stakeholders to respond to that call. So the whole idea is very simple, is basically to ensure that policy making does not happen in a vacuum. Policy making is not somebody coming down from the mountain and saying, I have the solution. It is rather the other way around. And as we have just heard, there are excellent examples in many parts of Europe, sometimes at a local level, in a municipality maybe, or in a region, but doesn't travel very far. Why? Because that needs support, that needs instruments, that needs sometimes financial or technical or other means. So our role is that of a catalyst. We are not there to set the agenda, but we certainly are there to help promote this agenda.
All right, thank you. Maybe one last question to Bart. Bart, what do you think is the most significant outcome, your personal highlight maybe of this year's symposium?
Yes, thank you. We really are now in increasing velocity in the momentum by giving, for instance, listening to the Mr. Sekel from the European Commission, setting up the platform. So we're actually, during this year, we shared many practices and ideas from out of different states of countries of Europe, but we are now, I really have the impression that we leveled up now and that we are now also recognized by the European institutions as a stakeholder organization with on the topic of pain. So that's my impression of the positive outcome of this Malta meeting.